In Birmingham, this is the police response to a spiralling number of mental health-related calls. An officer, together with a paramedic and a mental health nurse. It's called the triage team, and they've been called to support officers dealing with a mentally ill man who's claiming he's God.
Do you have any medical conditions?
The aim is to allow frontline police officers to return to duty more quickly, while reducing the number of patients who need to be detained.
This is a vulnerable person. We've turned up, we've relieved the officers to go back to their duty. Because we've got a paramedic with us, we've negated the need for an ambulance to come because we've done our own medical checks.
But according to today's report, cases like these are now placing an intolerable burden on overstretched police forces, accounting for a quarter of their calls because of what's described as a broken mental health system.
This is an enormous draw on the resources of policing. Some of that demand, rightly so, rests with the police, but very much of it, so the aftermath of that initial contact, then ought to be being pushed back into the health service.
Often it means patients don't get the best help. Carl Knight had a mental health crisis when he was a student. He couldn't get the medical support he needed, so friends had to go to the police.
When you see the blue sirens for these people in their sort of combat-esque vests, it's quite alarming, and definitely there is a possibility of that sight escalating somebody's crisis.
Back in Birmingham, the patient was taken to a community mental health service. The government says it's investing £2 billion and praised police leadership. But officers say they should only be the last resort in a crisis, not the first. Ben Chapman, ITV News, Birmingham.